Hello everyone, and welcome to this next lecture about the case history of a young person presented with shortness of breath, chest pain, and tachycardia. So in the last slide, we had discussed about the symptoms of emphysema, and we had said that the patient presents with breathlessness on exertion, and eventually as the disease progresses, patient will develop breathlessness most of the time in advanced stage. There is an increased susceptibility to development of chest infections due to a reduced immunity of the patient. Thirdly, the patient will be having a lot of cough, which would be productive of phlegm. Fatigue or weakness would be present because the body is unable to provide oxygen to the vital organs, as a result of which the person will feel weak and fatigued. The chest will develop a specific shape which we call as barrel-shaped chest. This takes place due to expansion of the rib cage in order to compensate or accommodate for the enlarged lungs. Finally, the person will develop a bluish tinge called as cyanosis due to deoxygenated blood, which takes place due to lack of oxygen as the lungs are not functioning properly. Now let's move on and talk a little bit about the structures of the lung. And we will be talking about pathophysiology of emphysema. Beginning with structure of the lungs. The lungs are sponge-like structures which are 2 in number and lie within the chest, protected by the rib cage. They are made up of progressively branching air passages. Starting from the top, the largest of these are the trachea, usually basically a single trachea, also called as the windpipe, which divides into 2 bronchi and which further divide into smaller airways called as bronchioles. Bronchioles end in minute air sacs which are called as alveoli, where the gas exchange takes place. The inhaled oxygen is transferred to the bloodstream, which is in the vessels, pulmonary vessels, and carbon dioxide is transferred from the blood into the exhaled breath. This exchange of oxygen and carbon dioxide takes place via fine meshwork of capillaries which are present in the lungs. So basically at molecular level, this gas exchange takes place where oxygen from the airways in the lungs enters the bloodstream and carbon dioxide is removed from the blood vessels and they are exhaled outside. And when the oxygen is absorbed from the blood vessels, it goes to the left side of the heart, where the left ventricle pumps it to reach all the major organs of the body. Now let's talk a little bit about pathophysiology of COPD. So what happens in COPD, chronic obstructive pulmonary disease, is that the lungs and airways get damaged. After repeated exposure to the chemical irritants such as cigarette smoke or other pollutants in the air passages and air sacs of the lungs become extremely inflamed and damaged. The airways of healthy lungs have elastic properties, but in the lungs that are repeatedly exposed to irritants, the airways lose their elasticity and become thickened and swollen. This swelling means that the passageway for the air becomes narrower. If the same person also has chronic bronchitis, which is ongoing inflammation of the lining of the bronchial tubes, the mucus present can further contribute to narrowing of the air passages and clogging of the air sacs, further reducing their ability to function. As the number of functional air sacs reduces, the number of capillaries servicing the damaged alveoli also gradually reduces. So continuing with pathology of COPD, These changes result in partial blockage of the passages carrying inhaled and exhaled breath, reduced capacity for the lungs to extract the oxygen from the inhaled air, as a result of which the person has to breathe harder to get enough oxygen. So this is a little bit about how the airways get damaged in chronic obstructive pulmonary airway disease. Now let's talk a little bit about diagnosis of emphysema. How is emphysema diagnosed? Chronic obstructive pulmonary diseases, including emphysema, are mainly diagnosed by using a lung function test called as spirometry. Other tests that may help in the diagnosis of emphysema include chest x-rays and CT scans. So basically, as far as this patient is concerned, the disease emphysema is in its early stages and it hasn't led to much destruction of the lungs at the moment. However, we need to take some measures in order to improve the overall health of this individual and prevent further progression of the disease. So this concludes this lecture, and in the next lecture we will be talking a little bit about treatment of emphysema and complications. Thank you very much for watching.